President Biden's COVID diagnosis took many people by surprise, but it actually comes as more people are reporting positive cases.
Joining us live on Zoom is Dr. Brian Bora, who is the medical director for the Chicago Department of Public Health. We thank you so much for being here.
Thank you both. Happy to be here.
Tell me how you thought. What was your initial reaction when you heard about the president's diagnosis? Were you surprised, or were you like, okay, it's possible, this makes sense?
Yeah, we are seeing an increase nationwide of COVID cases right now. So in that sense, it wasn't a huge surprise. Of course, it's always a little bit concerning anytime anybody gets sick. But I think we're in a much better place now than we have been, in other years during the pandemic.
What is the status of COVID here in the Chicago area, and how does it compare to other areas of the country?
We are starting to see some increase in activity here in Chicago. I think it's a little bit later than other locations in the United States have experienced, particularly out west. They've sort of already peaked in their COVID activity and are hopefully coming down. Here in Chicago, we are seeing an increase in some of our early metrics, things like test positivity and our wastewater activity levels. So those things, can predict, a wave that is here or on its way.
Doctor, we're several years down the road from this pandemic. Does it seem to follow that the symptoms would be, generally speaking, would be milder per se among the population?
Some really good news across the nation and here in Chicago is that despite the fact that we are seeing more COVID activity and we are seeing, a decent number of COVID cases, the number of people getting really sick and needing to be hospitalized and the number of people we're seeing dying is going down. And we are still seeing very low hospitalization numbers here. The severity of disease here in Chicago seems to be still very low.
It was noted that when we knew President Biden was diagnosed with COVID, he boarded Air Force One without wearing a mask, at least at that time. Can you remind folks best practices, what you should do once you do get that positive test?
The most important thing to do when you test positive for COVID is to stay home. Stay home when you're feeling sick. Really only be around other people when you're starting to feel better and when you've been fever-free for at least 24 hours. Wearing a mask is always another layer of protection that we recommend, especially if you're going to be around vulnerable people. And of course, other things still apply. So if you want to decrease the risk of getting COVID or any respiratory infection, open those windows. It's summertime, it's nice out, increase the ventilation wherever you are. That can go a long way to preventing illness.
Hey, Doc, we got about 30 seconds here. Moving forward, the last I seem to recall is like, this is going to be something people should be getting these booster, like the flu shot every year. Is that still the general consensus?
It is. So we have early recommendations. We know there's going to be an updated COVID shot coming soon. We know it's going to be recommended for everyone 6 months of age and older, similar to last year. We'll have a lot more information in the coming weeks about the specific shot coming out.
All right, we will look forward to that. Dr. Brian Bora, thank you so much for your time.
Thank you both.